Hello, everybody, and welcome to the Aftersight podcast with Audio Information Network of Colorado. And I am super excited today to introduce somebody I've known for a long, long time. And it's been neat over the last few months that we've kind of got reacquainted. And it's Beth. Is it Gustin or Gustin?
It is Gustin.
It is Gustin. Okay, great. I know her as Beth. So Beth is a therapist in her own private practice. She's a licensed professional counselor, nationally certified counselor, and certified EMDR therapist. And she will tell us what that acronym stands for. She primarily works with individuals experiencing grief and loss due to death, and with those wishing to address current impacts of past traumas. Beth also currently works part-time at a community mental health agency, and she's also working on a public speaking career. And with all of that, in her spare time, Beth enjoys reading, being in nature, and of course, spending time with family and friends. Welcome to the podcast, Beth.
Thank you. And thank you for having me. I'm really excited to be here and I'm really glad for the opportunity.
Wonderful. First of all, tell us what EMDR stands for.
So EMDR stands for Eye Movement Desensitization and Reprocessing. And it is a form of therapy or modality of therapy that can help individuals who feel like their experiences of past traumatic events still impact them today.
Wow. And is that like childhood trauma?
It can be childhood trauma. It can be more recent trauma. It's any event that a person experiences that they feel like they have received, trauma from. So we typically think of things like post-traumatic stress disorder. And that is a really common diagnosis that somebody might wish to use EMDR for to help with. But it isn't limited to just post-traumatic stress disorder. It's any event that a person experiences as traumatic that they feel like still really affects how they function day to day in the present.
Wow. And I'm a little bit familiar with it. I've never experienced it myself, but I've seen examples of it. And explain to us a little bit about the eye movement. How does that trigger different things on the brain and is used in this particular practice?
So the theory is that when we experience a traumatic event, that gets stored in the brain as a memory, of course, and we end up forming what are called maladaptive memory networks as a result of this traumatic event. And so the eye movements, which are also called bilateral stimulation or BLS, they help kind of connect the left and right hemispheres of your brain, and they help you better access and reprocess and desensitize that traumatic event as you are working with a therapist. And they also help us, the BLS also help us to better install a more positive belief you'd like to have about yourself instead as a result of that event. So an example might be if somebody comes in with a belief about themselves that maybe is something like, I am not lovable. Then we will look at this through the EMDR model, which basically says we have one foot in the past, we have one foot in the present, and we are looking towards how we want to interact with our future to make it more helpful to us or so that we function better in the future. It's also called the adaptive information processing model. I don't know how deep you want me to dive into this here, but
okay. Well, I'm interested. One of the things that is curious to me, because you're blind, and yes. How would somebody who doesn't use their vision, I guess that's the words you would use, would this kind of therapy work on somebody who's blind?
Absolutely, because there's more than just the eye movements that fit into the BLS option. So we have eye movements. There are, most of my clients, whether they're sighted or not, they actually prefer what are called pulsators or buzzers, same thing. And they are just little tiny handheld, I don't know what you call them, pulsators that vibrate. alternately in your left and right hand. And so you can hold them and they just vibrate. Sort of like when your cell phone rings, it's kind of like that vibration, but it's either faster or slower, and it alternates left and right. If you don't like those, there is a headphones you can wear that alternately beep in your ears. And pre-COVID, we were using what's called tapping. So you can tap on the tops of someone's hands, or you can do self-tapping, where you cross your arms and you have your left hand on kind of your right collarbone area and your right hand on your left collarbone area, and you can tap on yourself.
Wow. I have no idea who taught me that technique you just mentioned. I don't know where I learned it. It was maybe it was you forever ago. And I used that probably daily. And I had no clue that that was related to EMDR. That was just something that I'm sure somebody taught it to me, but I mean, decades I've been doing that, the arm crossing thing and tapping. And I teach that when I'm doing teaching rock climbing or even hiking, where people get really stressed because they're doing something scary. I'll get them to do that to calm down, and it's amazing. But I had no idea. I wonder where I learned that. That's kind of a neat thing for me to realize.
Yeah, we call it the butterfly hug. So I'm not sure where it originally came from. I learned it in my EMDR training.
Okay.
But you also can tap on your thighs as well. You don't have to cross your arms for that, but you can tap on your thighs, and some clients prefer that as well. But the key is that left, right, back and forth bilateral movement. That's the key is for EMDR.
That's amazing. That's amazing.
And yeah, it works really well because you have what's called the vagus nerve, which is a nerve that kind of runs up and down kind of both sides of your body, kind of like around like your chest area.
Okay.
And so when you're tapping on yourself, you're also stimulating that vagus nerve.
Oh, okay. Our bodies and our minds are so amazing to me, like how they all work, and also how fragile they can be, but also how robust and how we can bounce back.
Yes.
After trauma. And so Beth, I know that you know, it's really important to you about working through grief and the different types of grief. And you just have these amazing coping skills that you can teach people. Why is it so important to work through the griefs of our past when, I know people, I have this terrible saying, and I use it mostly when I'm hiking with people or rock climbing. They'll complain, I'll say, suck it up. Like, and then it's terrible. It's a terrible term, but it's something that I use. And I know other people are like, oh, that was in the past. It doesn't affect me now. I'm a big believer in mental health and to do whatever you need to do to, either put you back on track or put you on a track that you've never been on, but you would like to be on. So I'm a big believer in that. But can you share with our audience a little bit about that? Why is it so important to work through those griefs and the different types of grief? It's not all a parent dying or something. A grief comes in all different layers.
It does. And I think, first of all, I'm going to back up for just a second, so I apologize. But I want to talk about the vagus nerve for one more second, and then I'll talk about the grief. And I'm sorry for backtracking.
No, it's okay.
But I want to explain a little more. So the vagus nerve connects your body to your brain, or your brain to your body. It goes both directions. And it has to do with your parasympathetic and sympathetic nervous system. And so the reason why tapping works, for example, is because it helps calm down the various parts of our nervous system. And so certain movement or sensory activities can either activate or quiet down that vagus nerve.
Okay, that makes sense.
So now going back to grief, I think it's really important to work through our grief for a number of reasons. As with many emotions, if we don't express them, our bodies will express them for us. So if you, for example, maybe have a lot of anger that you're holding inside and not having a healthy outlet for, or this is true with grief too, but you might find you get headaches or stomach aches. You might find that you have really tense muscles. You might find that you're extra fatigued, more than normal, more than what the grief process already brings on. You might find that you get physically sick a lot more. And again, grief is going to exacerbate those things. But if we hold all those emotions and feelings inside, our body's like, well, it has to have somewhere to go. So I'm going to express it for you in a lot of, more somatic ways.
That definitely makes sense. Because like you said, our minds are connected to our bodies and vice versa.
That's why breathing works so well. And, I know breathing is a really simple thing that all of us take for granted for the most part. But the reason deep breathing works so well is because if you slow down your breathing, then it will force your brain to slow down so your mind is not racing so much. If you can slow your thoughts down, then your heart will stop racing because your body will slow down.
Yeah, I know, when I have a stomach ache, like I'm feeling nauseous, just breathing into my stomach, it's amazing how it works. Like the nausea will go away, just breathing. And it's amazing.
And just as an aside here, is it going to go away forever? Not necessarily. Yeah. If it goes away for a second or a minute, then you're giving yourself, a few seconds to a minute of relaxation and peace and calm. And that's going to give your brain enough time to respond differently.
That's true. That is so true.
Over and over and over again.
Yeah. What are some of the other things that people could do besides breathing?
It depends on what you are trying to kind of work with. But if we're talking about grief, since that's one of the main things we work with, I encourage my clients to either write letters to the person, the pet, the thing that they are grieving. So if you have lost your sight, you can write a letter to your vision loss. And in that letter, you can write everything you want to say to it. I think it really helps to externalize something. So, an example might be, I'm not depressed. I'm a person living with depression.
Oh, that's people first. That people first language.
It really helps in my mind in the mental health world because, and if you can label that, like some people will name their anxiety or they'll name their depression or they'll name their grief. So it's almost like you're giving it its own personality. But that can be really helpful if we can externalize it because it helps us take back our power so that we stay kind of in control of it. It doesn't run our lives.
Wow.
That's one coping skill, since we're talking about coping skills. But writing letters is super helpful. Whether you choose to keep them or not is up to you. Some people find it really helpful to write that letter. I know there's nowhere to send it if we're talking about grief, as far as like due to death loss. But sometimes it can be really helpful to write that letter and burn it in a really safe environment. I know with all the fires right now, that may not be the best thing to do. But if you can burn it in a safe way that's contained, you could bury it. You could tear it up in little pieces. You can keep it.
Wow.
But that can really be a release for a lot of people. You also can do the same thing if you're a musician. You can create music. You can write poetry. You can create jewelry. Just anything that's may not be talk oriented can help get it out. There's a lot of techniques around working with negative thoughts, letting go of negative thoughts. So one example might be, and you can do this in two ways, but visually speaking, if you can visualize in your head, then you can visualize these thoughts are like leaves and they're blowing away on the wind and they're leaving you, blowing away. Or Some people like to put them in a big trash bag on the curb and the trash person can come take them away. Or if you're more concrete, you can write down those thoughts and you can put them in a box with a lid and put that box somewhere where it's contained, out of sight, out of mind. Don't think about it. That can be helpful as kind of a more in the moment thing you can do.
And then with your practice, do you sort of discuss the best ways of doing, because you've listed off a lot of really amazing techniques, or do you let your patient like pick which one, or like kind of what's your process with that?
So my clients, this is, yes, I'm a therapist, and yes, I am in a role to hopefully work with someone to help them feel better, but it's a very collaborative process. And so I want to know, are you more concrete? Are you more abstract? Are you more tactile? Are you more auditory? Mm-hmm. Let's find the skills that work for you, because I could give you skills all day long, but if it don't work for you, that's not going to be helpful to you. And so it's really important to me that we work together to find out what best resonates for you, what best fits for you. And you have to practice it. You can't just practice it in session with me. You have to practice it between sessions. Yeah. Because that's how you know they're actually going to really work for you, is when you are a little more stressed out and activated. Yeah. When you practice those skills, practice them when you don't need them too. Practice them, but when you're calm and relaxed as well. So you learn how to do it. But then you actually put it to the test. When you're a little bit stressed out, practice it. Does it work? Because if it does, then you know it's helpful to you. Yeah, that makes sense. If it doesn't, then you come back, we'll talk about it, we'll find something else. Yeah. The therapy is only as good as what you put into it. Honestly, you get out what you put in. Yeah, that makes sense. It's kind of like when if you hire a trainer at the gym, they teach you, you're in the gym and you do A, B, and C, and then you're supposed to go home and do those at home and practice them. But if you're only doing A, B, and C when you're standing in front of them and you're hating every single moment of it, one, you're not going to stick to it. And I really don't think that it's beneficial. Where if you can find something that you actually, connect with, you're more likely to do it. Absolutely. You have to work the mental muscles as well as the physical muscles. Absolutely. Yeah. Oh, wow. Well, Beth, how can somebody get a hold of you? And what are some of the things that you are doing? Like, are you doing groups? Are you doing individual? Are you in person? Are you virtual? Share a little bit. So I provide sessions in person or remotely. I can work with any client who resides in Colorado. Okay. So as long as you're in Colorado, we can do a session remotely, or if you do want to come to my office, which is in Westminster, Colorado, that's an option too. So I provide either one, whichever is more comfortable to you, whichever just makes the most sense to you. The best way to get a hold of me, I'm going to give you my email address and my phone number. Either one will work. My phone number is 303-335-9059. And my email address is beth@transitioningthroughchange.com. And the website, if you choose to go there, has a contact form as well. And the website is just transitioningthroughchange.com with the www in front of it. Yeah, and we'll put those in the notes for the podcast if you did miss that. And if you just completely miss it, you can always reach somebody at Audio Information Network of Colorado, and we can provide that as well. To answer the question, I currently provide individual sessions, and I am looking to add some groups in the coming year. I have 3 different things I'm hoping to get off the ground. One is a group around pet loss, be it service dog, emotional support, or pet. There's a huge need for that, for what I'm seeing, and that's something I'd like to be able to offer. And then I also am planning to offer more of a mental health support group, possibly around disability mental health, and potentially a support for those who live with someone with a disability, because I think there's a whole not often spoken about grief process, adjustment process that those who live with us go through.
Yeah.
There needs to be a space for that. And that's something that I think would be really helpful and something that I'd like to provide in the coming year.
That's wonderful. There's such a great need for all of those. And, being a guide dog user, it's when I've had to say goodbye to my dogs, it is devastating. And I think that, especially in the United States, that it's not acknowledged as much as it should be, that is a grief that you go through.
If you think about it, and I don't want to go off on a tangent here because I could talk about this all day long.
Yeah.
But grief as a whole in our society overall is not acknowledged well. If you are employed, you get 3 days of bereavement leave?
Yeah.
And then you're supposed to go back to work.
Yeah.
There's an expectation, whether you're working or not working, that we just move forward and move on. And does our grief ever go away? No, but we don't want it to, because that would mean that we lose that relationship with the person or the guide dog or the emotional support bird or whatever it is that we're grieving. Yeah. And the whole goal, in my opinion, of grief is to maintain a relationship with that person or service animal or dog or pet that you're grieving, because they're always going to be a part of us.
Yeah.
And so I think as a fellow guide dog user as well, it is a loss that we call this disenfranchised grief. And that is a loss that is grieved by many, but most people don't understand that loss because they can't relate to it.
Yeah. Yeah. And the caregiver part, again, I think it's better than it used to be, but I feel like caregivers have really been overlooked on so many levels. And they tend, they're caregivers, and they don't take care of themselves. And because, again, I think society has sort of not opened that box, right? That caregivers also need support and are grieving too. And they don't get that support that a lot of times the person actually going through it is getting.
I agree. And I encourage my clients, and I will also offer family sessions specific to this around, I think it's really important that those of us living with a disability, be it blindness or something else, talk to our loved ones about hey, we know this is affecting me, but let's talk about how it's also affecting you, because I don't want resentment. I don't want anger. Let's really come together and have a conversation of hey, I get that you're probably grieving my vision loss too, because not only are you missing, grieving what I can't see because you feel for me, but it's also creating a different relationship, as we're living together, because roles change.
Yeah.
And so I really encourage those conversations. And if a client, would like to have a third person present to facilitate that, that's something that I offer.
Oh, wonderful. Wow. Gosh, we covered a lot, but I feel like it's the tip of the iceberg, Beth. And so I'm
always glad to come back on a future episode if you'd like to have me.
Absolutely. Absolutely. Yes. And we always, ask our audience that if they do have more questions, or if this is a topic that they would like us to, kind of dive more into, to please reach out to us. And, we're only as good as the people listening out there. And so feel free to reach out to us. Mental health is, to me, it's the cure for our bodies, our ailments. And I know you mentioned that at the beginning, but I'm a big believer in the body follows the mind, and I know it goes both ways, but I just know for me personally, when I'm in a good headspace, I tend to, my body seems to follow, versus the opposite. It happens the other way too. When I'm not in a good headspace, it can, everything seems more exasperated when it comes to how I'm feeling.
I think it's really important to be in a good headspace, because it makes everything else a little more tolerable than if we're not in a good headspace. And I know there's a lot of schools of thought around affirmations. But I think affirmations can be helpful, whether it's something as like, I am strong, I am capable, I am fill in the blank, as long as it's positive. I think those things can help us. And they can just be a really quick reminder. I mean, I laugh at me if you want, it's okay. But there's nothing wrong with leaving yourself a voicemail randomly that you pick up like the next day, or saying something to yourself in the mirror, even if you can't see it. Or I don't know if the website still exists. I think it's like futureme.org or something. But you used to like write a letter to yourself and send it to yourself.
Wow.
At a future date, and those things might sound a little bit like, really, but they can help.
Yeah. That's for sure. So yeah, thank you so much for that, for coming today, Beth, and sharing how important it is that we don't ignore, our past traumas, and that dealing with them, and it's not too late, even if you've never been in therapy or have never been in a group situation, that it's not too late, just because something happened maybe a long time ago. It's still there, and we can still work through it.
It is never too late. I work with clients who are in their 70s and they are working on things, and it's never too late. I work with clients who are in their 80s. It doesn't matter how old or young you are. What matters is that you want to make a change in your own life that betters yourself. If we don't care for ourselves, we can't care for anybody else.
That's true.
And I think it's really important that we, put our mental health equal to our physical health, and that we take care of both.
So Beth, what's one of your affirmations that you use?
Oh gosh, I have a lot of them. I think because I am working on, a lot of different things, and have recently been able to shift my life to add more class to my practice. I think the biggest thing I'm working on right now, affirmation wise, is something along the lines of, I am creating space, for my future goals and to help more people, something like that. I am holding space for the things that are important to me that will then allow me to help more people. So I'm keeping it kind of a self/other focus as I'm expanding. And there's days where I'm having some self-doubt and my confidence decides to take a vacation, and it's just like, you know what? I'm okay. I'm moving as fast as I can. I am okay. I'm good enough as I am, however you want to phrase that. But that's a hard question, because it kind of depends on the day.
Yeah, that's true. That's true. And what you're working on, and that kind of thing. So that makes sense. That makes sense. So is there any last words you would like to share with the audience, Beth?
I think that the biggest thing, I guess, if I could leave you with something is, like I said, make sure you take time for you. You are important too. And because you are important, do what you need to do to take care of yourself. Create that 5 minutes a day, if that's all you can find, that's for you. If that means you drink your cup of coffee or your tea or your glass of water, and that becomes kind of your me time, then do that.
I like that. And I think we all need to be reminded of that. And you don't need to spend, an hour every day. It'd be wonderful if you can, and that is lovely if you can take an hour to do meditation or something. But sometimes it is literally minutes, and that can make such a huge difference.
It can.
Yeah. Well, Beth, again, thank you so much for coming and joining us today. Please, everybody, reach out to Beth for yourself or somebody you know. Like I said, I've known Beth a long time, and I think she's pretty amazing. And her contact information will be in the notes for the podcast. So everybody be well, take care of yourselves. And as Beth just pointed out, even if that's just a few minutes a day, it's important.